All right, welcome to this edition of the Zuri Plastic Surgery Podcast. We want to talk about the Brazilian butt lift. And this is a very important topic, so please listen up. This is one of the most dangerous operations in plastic surgery. Okay, we have quotes in the scientific literature that there is a mortality of 1 in every 3,000 Brazilian butt lifts. Okay, so this is serious, and this procedure demands a tremendous amount of respect from the surgeon and the patient. One of the reasons that I wanted to discuss this topic is because there has been a lot of ups and downs regarding the Brazilian butt lift since it was introduced more than 10 years ago. And the reason for this is that the science has really changed regarding patient safety. At the beginning, a lot of surgeons were injecting fat directly into the muscle of the buttock. And the buttock muscle is very large. It is probably one of the largest groups of muscles put together in one spot, in one area of the human body. And, to get the maximum results at the beginning, the thought was, well, let's inject this fat. Let's do liposuction, okay? Let's go ahead and inject that fat directly into the buttock. And this concept became, very revolutionary at the time. Nobody had ever really thought of injecting fat directly into the buttock, period. And it basically took society by storm. It was coined the Brazilian butt lift, okay? But in reality, it's not particular to Brazil. It's a nationwide, basically worldwide phenomenon, and unfortunately, there have been many deaths related to this operation, and I'll explain why. So, when injecting fat directly into the buttock musculature, you have a much higher chance of damaging the arteries and the veins that live in the deep buttock. If you were to see anatomy photos of the buttock, you're going to see that way down deep at the base of the buttock, you basically have two very large and very important blood vessels. One is the inferior gluteal artery, and the other one is the inferior gluteal vein. You also have a large nerve in that location called the sciatic nerve, which is extremely important in you being able to walk and to flex your lower extremity, and so that's very important to consider as well. But in essence, if you inject deeply into the buttock musculature, you have a higher chance that you're going to hit or perforate one of those blood vessels, and that you are going to push fat into them. Now, what happens when you push fat into one of these blood vessels? Well, again, we are a circulatory system in terms of our blood vessels. Everything connects. It's one big circle. Okay, so whatever goes in one location is going to end up going through the entire circuit of blood flow. So if enough fat gets in that vein or artery, for that matter, it's going to travel to your heart, to your brain, and to your lungs. The question is, how much fat was pushed into those vessels, and what can your brain or your heart or your lungs tolerate? And if it's a very small amount of microscopic fat, they're going to tolerate it fine. It's going to get through the system. It's going to be broken down eventually, and nothing happen. But if you get enough fat in there, it will basically stop your heart immediately on the operating room table. It will get stuck in your lungs, okay, which will also impact the blood flow to your heart and cause other circulatory collapse. Or it can go to your brain and basically give you what would be otherwise a stroke. Okay, part of your brain would die because a big chunk of fat will get stuck in one of those blood vessels, and it would block off blood supply to part of your brain. So, with autopsy studies and with further research with all of the plastic surgery societies in the United States and across the world, we were able to figure out that injecting fat directly into the muscle was dangerous. And although a lot of cases and a lot of patients never had a problem with fat injection into the buttock, it was found to be not safe and not basically allowed to do anymore by many of the health departments across the U.S. So in this process, in this evolution of the quote-unquote Brazilian butt lift or fat grafting to the buttock, came in the thought of using ultrasounds. And basically an ultrasound is a device that's used to see beyond the skin, so see into deeper tissue. It's not of the same accuracy as a CT scan or an MRI, but for functional purposes, it's a very simple tool that can be used by a surgeon or his assistant to basically visualize with a handheld ultrasound device that projects onto a tablet what is going on underneath the surface. So when you bring in the cannula that has fat in it and you're going to fat graft the buttock, you're literally watching your cannula go through the subcutaneous space. And what you're trying to do is make sure that you're not puncturing the buttock muscle and that you're injecting fat inadvertently or mistakenly into the muscle. So this has been revolutionary. Again, I always say on this podcast how amazing plastic surgery is because we don't cease to try to make improvements. We don't cease to try to bring in technology into our specialty to take it to the next level. So ever since that ultrasound technique has come about, which basically almost started when I was graduating from the Cleveland Clinic, I adopted that technology immediately. I also wrote some scientific papers regarding the use of wireless ultrasound in fat grafting. And I thankfully have had a tremendous amount of success with the use of the ultrasound in regards to patient safety and avoiding fat injection into the muscle, and of course, let alone into those much deeper blood vessels that I spoke to you about earlier. So nowadays, it is basically being advocated by the Department of Health here in Florida, to use this ultrasound device every single time you inject fat into the buttock. And I am a firm believer in that. I am a firm believer that technology in this regard has helped us at least to visualize where we are and in the buttock. And that I do believe will lead to success in regards to patient safety. Now, the ultrasound is not perfect. I do think that there can be some significant advances in ultrasound technology, but that I think is yet to come. And hopefully within the next 5 to 10 years, we have a more modern or a more high definition ultrasound device that we can use for buttock fat grafting. What I will tell you is not to shy away from the idea of the Brazilian butt lift or buttock fat grafting. I think a lot of people, because of all the things that have happened and all of the deaths related to the Brazilian butt lift, a lot of people have ran away from it, kind of shied away from it. And I will tell you, there's no need to do that as long as you are going to see a board-certified plastic surgeon who has experience using the wireless ultrasound device. Make sure in your consultations that you ask about the wireless ultrasound device, how long the surgeon has been using it, and what has their success rate been with the technology. Because anybody who's injecting fat nowadays into the buttock without visualizing what they're doing, I think is going to put the patient at a very high risk of a very serious complication. So, again, part of listening to this podcast is also opening the door to you to access me as a surgeon and to learn more about this in consultation. I'm always happy to have colleagues, surgical residents, prospective patients to contact our office for further information. So that's basically the summary of the Brazilian butt lift in terms of safety. Now, in terms of results, I will tell you that the results are life-changing, totally life-altering. There are many patients out there that would benefit in terms of their proportionality, and balancing the harmony between the breast, the buttock, the waist, the flanks. That this procedure to me has been amazing in my ability to do improvements in terms of body contouring. So, please keep that in mind, that it is a very powerful surgery. It does provide for some fantastic results. You got to be willing the first month to really put the work in terms of protecting the buttock. You don't want to be sitting on your buttock right away. We do provide you with an ergonomic pillow that you're going to use while you're recovering from the operation. And you're going to be wearing compression garments and getting massages done. So it is a little bit labor intensive, for the patient as well. But again, the results are phenomenal. So in terms of the BBL, just think about wireless ultrasound, where you're going to have the procedure done, what is the experience of the surgeon, and just be ready for the time commitment that it's going to take for you to recover from that type of surgery. So again, if you have any other questions, always reach out to us. We're happy to help out. And yes, thank you so much for listening to this edition of the Zuri Plastic Surgery Podcast. And we hope to see you for the next one. Thank you.